Good afternoon and welcome to the NACC's Meals on Wheels and APSE webinar. Thank you to everyone for joining us today, and especially thank you to our sponsors for today, Hobart UK. I'd like to start this webinar by introducing a little more about Meals on Wheels Week. Meals on Wheels Weeks, the aim of the Meals on Wheels Week is to highlight the social, economic, psychological and preventative benefits of Meals on Wheels and community meal services in the UK, whether delivered to the homes or via day centres and lunch clubs, encouraging public support for the local Meals on Wheels services and to address the increased awareness of loneliness, social isolation and the well-being of older and vulnerable people living within our communities. The National Association of Care Catering have commissioned the Association of Public Sector Excellence to conduct research into the provision of local authority community meals and meal services, which are still in service across the UK in 2023. The research was to understand the scope of the provision, the cost of providing the service, the menus, food and wider provisions. This report was launched this morning. Today, we are joined by APSE, who will share with us these findings of the research paper, and also by Mo Baines, who is the Chief Executive Officer of APSE, who will speak to us about the local government funding and its future for social care. But before we begin today's webinar, I just want to give a little bit of housekeeping to go through with you. The chat function is at the bottom of your screen. So please do say hello, tell us that you're here and get involved in the chat. You can direct chat to just the panelists or to the panelists and the attendees. If you have any questions for our speakers, then please post them in the little small box at the bottom of your screen. And when we come to the question and answer part of the webinar at the end of the session, we will make sure we direct these questions to the right speaker. A bit of an advanced apology. If we don't get time to answer your question, please do not worry, because after the webinar, we will come back to you and answer those questions for you. Just also a little reminder that the webinar is being recorded. So if you want to watch it again or share this webinar later on with your colleagues, then you will have the opportunity to do so. A link for this will be provided at the end of the seminar. So enjoy today's webinar, and I'm now pleased to introduce our first speaker, Vicky Hackling, who is the Principal Advisor for APSE. Over to you, Vicky.
Hi, good afternoon, everyone. I'm Vicky Hackling, Principal Advisor at APSE, who's primarily been involved in conducting the research and producing the report. So I'm just going to, I'm joined today as well by our Chief Exec, Mo Baines, who will be online to answer questions and such like at the end. Okay, so just a little bit of context about the research. APSE has undertaken this research in 2016, 2018 and 2023. Because of the time span that we've undertaken the research, it allows us to make some quite stark comparisons as to the provision of the service and the direction of travel. We undertook various methods of gaining the information, one of which was a desk-based research. We've conducted a survey with the local authorities that provide a Meals on Wheels or community meals service, and we also contacted local authorities directly to ascertain more information and to clarify any points that we needed clarifying. Okay. When we talk about the context of local service delivery models for Meals on Wheels, local authorities opt to do it in several different ways that meet their needs. So you've got local authorities prepare and distribute their own meals. A local authority may choose to buy in meals and then distribute it themselves. local authorities tender for a contractor to provide their meals. That could be a private sector contractor, it could be voluntary service, and subsidise that service. And also local authorities don't provide any service at all, but they will provide signpost people in their local authority area to provision within their areas. So just for clarity, in this report, local authorities that only signpost aren't deemed as delivering that service. So I thought for this year, when we've done the report, I thought it was quite interesting to go into the background of Meals on Wheels, look where we've come from to where we're getting to, because I think that sort of tells the story. So as people on the call will know, it can be traced back to the Second World War, where in effect the Women's Voluntary Service provided food for people who'd lost their homes during the bombing and therefore was unable to cook the meals for themselves. Many of these recipients were the elderly. Now, going forward in time, the first sort of legislation that came forward was the National Assistance Act of 1943, Section 3, which states that a local authority may make contributions to the funds of any voluntary organisation whose activity consisted of the provision or recreation of meals for older people. That act was then amended, going up to 1962, which then empowered local authorities to make arrangements for Meals on Wheels for the elderly. So that's where we get the basis of today's provision. And then in 2014, we got the Care Act. This, for the first time, placed the ability for people in receipt of care packages to have a personal budget, making the ability for them to advocate for themselves and exercise choice and control over how they wanted their care and support needs to be met. And I think that's quite important context that we're now in when you look at 2016, 18 and 23. Okay, so going to the survey and the results of the research. Okay, so the councils that continue to provide the service were asked a series of questions. To support the survey results, we've also conducted a desktop review, looking at websites, press releases, newspaper articles, all that sort of thing to underpin and triangulate the data that we'd received. And then we also contacted the local authorities directly to gain a comprehensive perspective. As I was saying earlier, because we did it in 2016 and 18, we now also have a pre-COVID and a post-COVID comparison, and we can see how the trends have changed and some of the areas of concern, which we'll come on to in the next slides. Okay. So, first of all, we needed to establish the authorities that were providing the provision. So this was broken down into regions in England. So as you can see there's a breakdown between the regions in England. And then we've got Scotland, Wales, giving us the UK average and the English average as well. One point to note with this is Northern Ireland do have a different administration arrangement for their provision for Meals on Wheels. So they are treated a little bit differently, but I think it's important to include them as they are part of the UK. So as you can see there, the data clearly shows that there has been a significant decrease in provision from the high of 66% in the first year, 2014, down to 29% in 2023. The largest declines from 2018 are in London, which is down by 29%. The East of England, which is 27%. East Midlands has gone down by 25%. And Yorkshire and Humber region has not seen any decline and remains at 20%. But it's fair to say it was already at quite a low in 2018. Whereas there's only been a 9% decrease in Wales, and in Scotland there we can see that there was quite a big decline from 2016 to 2018, from 75% to 61%, but that seems to have stabilised a little bit there for 2023. To understand a little bit more about why this significant decline had happened across the UK, there is a direct correlation between a contractor not continuing with the contract and the local authority making the decision to withdraw the service. So by this, what I mean is a contractor, for whatever reason, pulls out of that contract, and it acts as a break point for the local authority to review the provision and decide what they want to do going forward. That decline in Scotland between the 70% in 2016 Okay, am I back? I think am I back? Yes, okay. I think that can be directly associated with the Royal Voluntary Service gave notice that it was pulling out of all contracts within Scotland. Therefore, that's why that big decline was. Some of the other issues why there's been a decline, local authorities are reporting that when they put out tenders for the service, they're not attracting the providers to deliver the service, so they have no choice but not to continue with that. Because there's defined or reduced budgets for the service, when providers increase the costs, the local authorities having to make the decision that they can't meet that cost, so they have to withdraw from the service. Budget pressures, we'll come on to budget pressures a little bit later. The cost of providing the service has increased exponentially, and we will be having a look at that as well. And the range of alternative options for customers has also increased. Part of that is sort of due to the post-COVID world, with a lot of supermarkets, online delivery services, delivering food provision to the door. And also there is a report in declining numbers of people using the service for whatever reason. So moving on to the next slide, okay, your cost of service provision. So by cost of service provision, what I mean is the cost of a 2-course meal to the client. So 2018 revealed that across the majority of regions, there have been a decrease in cost charged. So as you can see there, it went from £4.30 to £3.60. Now that could have been because of the efficiencies that were put in place with the providers and the way that they delivered. But we have seen that cost increase now. So the 2023 data clearly shows it's been a significant increase, with the England average increasing by £1.17. The Scotland average has gone up by 89p, and the Wales average has increased by a smaller amount of 38 pence for the 2-course meal. From the data, the lowest price for a 2-course meal is £1.90, and the highest price being charged for a 2-course meal is £8, and that is by a local authority in the southwest of England. Yorkshire and Humber has seen a significant increase in the average cost for a 2-course meal, and when contacting these authorities and speaking to them about the reasons for this, they have directly attributed it to the rates of increase that the contractor has put in place to deliver the service on behalf of the council. Looking at the survey results, it's reported by 42.86% of respondents that the cost for the council of providing the meal in the last 12 months has increased by 10 to 20%. Just under 30% have recorded an increase of 10%, and just 21.5% report the increase has been by 20 to 30% in the last 12 months. I'm sure anybody on the call who delivers a service will recognise the increases, but the reasons cited in the research are the increase in the minimum wage, and now many councils have adopted the higher living wage, which is impacting on service costs, and the increase in food, utilities and fuel costs. However, councils and providers aren't just sitting still and passing on the cost to the customers. They are revising menus to reduce the cost of ingredients. They're working with suppliers. They're looking to reduce the number of meat and poultry and fish dishes on menus, all to keep that price down for the client. 30% of authorities reported that they subsidise the provision, which is actually a decrease from the 2018 research, which stated that 58% of authorities subsidised or part subsidised the service. When looking at the comments and the reasons why this has decreased, this could be in part due to the fact that councils are having to withdraw the subsidy due to budget pressures, and therefore there is a need for this service to be financially viable and wash its face. Okay, next slide, please. Okay, so we wanted to look at how the meal service is organised. So I've got, over the next few slides, I've got a few graphs for you with the information on. So this slide looks at how the service is organised, with just over 51% reporting that meals are delivered and supplied by a contract provider. Therefore, the local authority doesn't touch the meals at all. It's all done by the contractors. 33.3% say they produce their own meals and deliver them. What is clear from the research is that local authorities are looking at the needs of the clients, and they are tailoring the models of delivery to meet the needs of the service users and also balance the needs of the local authority. Next slide, please. Okay, so looking at when the meals are delivered, the vast majority of respondents state that they deliver the meals 365 days of the year. We've just got 12% there saying they deliver meals fortnightly. Where meals are delivered on a fortnightly basis, that's in the form of a frozen ready meal, and this is primarily done by a contractor that provides the service for the council. Councils will offer different versions of how they deliver the meals. Some will offer a daily service if that's what clients desire, and others will, as well as the fortnightly frozen delivery service. So as I say, it's a bit of a pick and mix to meet the needs of their local customers. Okay, next slide, please. Okay, so this just looks at how the meals are delivered. So the largest proportion there, the darker blue, that's over 65% of those who were surveyed reported that the food is delivered hot and regenerated, and 35% deliver hot meals that are freshly cooked, and just over 26% provide delivered frozen meals. In the main, the meals are delivered at lunchtime, with the option to receive additional meals such as breakfast, tea time meals and snacks at the same time that main meal's delivered. When looking at changes in how the demand for the service, it's difficult to draw any conclusions because I've had reports that the range of demand has decreased by 15%, up to local authorities stating that the demand has increased by up to 10%. Although I can't draw any concrete conclusions about demand, I think there are many factors that impact on that. These include how the council publicises the service. Some local authorities do a really good social media, the websites, stakeholders and other providers will publicise the service, while others do very little publication of it at all, and you just find a website with call this number. So that might have one sort of reason for why the demand is increased or decreased. The access to the provision from the client. Some authorities will let any person within the authority purchase Meals on Wheels. Others have a set criteria for the availability of the service in their area. So the pandemic itself has had a significant impact on NHS budgets and on social care, as we know. And councils report that COVID-19 has highlighted the importance of Meals on Wheels to the political leadership, especially as councils mobilise to deliver food parcels and various other provision to vulnerable adults and older adults self-isolating. And this provision was even delivered in areas where there was no Meals on Wheels service. So it really did bring into the fore the need and the positive impact that Meals on Wheels could have. So although the authorities report there's been an increase in demand in some areas and some have decreased it, I think there's also additional competition in the market which has led to a decrease in demand, such as I was saying earlier, the supermarkets and other companies invested heavily in their online offering and the delivery offering, but they don't always give the other benefits that Meals on Wheels services will, which we'll come on to there. Next slide, please. Okay, so it's very clear that there has been a significant decrease in the number of authorities that are providing the service, just 29%, as I said earlier. So we wanted to understand, as part of the research, what the challenges for delivering the provision was. So there was 3 key areas which came out in the research. One was the local government finance. In 2021, Unison reported that councils across England, Wales and Scotland faced a £3 billion funding black hole for 2022, and the Local Government Association in September have raised similar concerns about that £3 billion funding gap. Since 2000, we've had 12 councils declare a Section 114, which basically means that they can't balance the books. And there are others on the way reporting significant concerns that they are going to go down this road. Just today, Leicester City Council has published a warning in Kent and Hampshire earlier in the past few weeks. So the impact of the massive deficits on budgets in local authorities is meaning that they're having to make difficult decisions around what services that they provide. Now, there is no statutory requirement for councils to provide a Meals on Wheels service. And when councils are choosing what provision they want to make across all of the services, it's clear that they're opting not to continue to provide a Meals on Wheels service and see signposting users to the private sector or voluntary providers as an option. And with individuals, it's receipt of care plans having direct payments, they can procure their own care and Meals on Wheels service if they do choose. Looking at the voluntary and staff recruitment, many volunteers have opted not to continue volunteering. The Guardian reported in May this year that there had been a sharp decline in volunteers. The Charity Aid Foundation reported that people volunteering had reduced from 17% to 13% in the last 5 years. And with the high level of unemployment, low hours a week roles such as your Meals on Wheels service, and I also see it in other services across local authorities such as building, cleaning, education, catering, and they are competing for jobs across the job market, and with the private sector they can pay higher wages. Next slide, please, Tash. Okay, so the third challenge, and I'm sure you're all feeling this across your services, is the inflationary costs that we've had. the cost of energy and other goods. And I think this graph really shows it and highlights the impact on the increases there. Food is the yellow, energy is the purple, and other services is the green. So inflation has been actually relatively stable. So in sort of 2016-18, there wasn't much movement in the inflationary rate of food and goods costs. However, food prices have risen shortly in the past year, and we're 14.8% higher in July compared with the year before, and a 45-year high, a 45-year high of 19.1% in March. So over the 2 years from July 21 to 22, price rises have rose by about 30% for food, and to reach that same level, it took over 13 years, from 2008 to 21. So it's no question really that prices are rising and the contractors are having to pass the rates on to local authorities, and that shows the increase in the cost for a 2-course meal that we showed earlier. Okay, so that's all the doom and gloom, hopefully out the way. So one of the things that we want to do is look at the benefits providing the Meals on Wheels and community meal service. So I've highlighted 3 sort of areas here: support with the cost of living, supporting independent living, and reduces loneliness. And I think the benefits of the service can't be underestimated. But providing a client with a nutritious meal, and providing support with the cost of living, and supporting independence and choice for an individual, it allows the older person to stay within independent within our society for longer, and also have a better outcome in their living circumstances. Research into the impact on the nutritional intake has concluded that the nutritious meal not only benefits the individual, but the wider health and social care services. One of the detriments of health outcomes is that total energy intake is a positive influence on malnutrition risk and frail and older adults. And an increased protein intake supports good health, promotes recovery from illness, and assists in maintaining functionality in older adults. So that meal every day that's being delivered helps that person stay well, fit, and healthy for longer in the homes. And with having a driver who comes into the home on a daily basis, they can do that welfare check and also make sure that any signs of failing health is picked up at an earlier stage before it becomes a hospital admission, and highlights other examples of when support might be needed. The cost of living crisis is something that's come into focus starkly over the past 18 months to a year. And this brings with it food insecurity, which is having more of an adverse impact on the older people, as they've got a restricted income, and they can't gain additional money elsewhere, so they have that fixed budget. And the Meals on Wheels services enables people to get that access to that hot meal that they might not otherwise be able to get. Research by the University of Hertfordshire looked at the Meals on Wheels service and the food security of older people. And their report concluded that the Meals on Wheels service is a community asset, having a positive impact in supporting food practices and also food security. And looking at the final point there on that slide, the pandemic has increased rates of loneliness. There's lots of research now coming out about the impacts of loneliness and the pandemic. And the way that our society is now changing is also accelerating loneliness, especially an elder person. Whereas before they may have gone to the supermarket, had a chat with the person on the checkout, and a bit of human contact. But now we go to the supermarket and we're faced by self-service checkouts, for example, which reduces that human contact. And that's just one small example across our society. Therefore, that person coming in and having, delivering the meal and having a chat, it really helps with that day-to-day contact. There is an example of a council that's implemented a service called Meals and Chat Service, where the meal is delivered and there's time for the driver to stay, have a chat and build up that relationship with the older person. And research conducted by the University of Bristol about these interactions between the service providers and the clients suggests that the Meals on Wheels service provides significant benefit beyond just the nutrition there. And that one of them is the loneliness aspect. Next slide, please. Okay, so conclusions of the report. So this is just a quick overview and summary. Okay, the local authorities providing the services declined from 66% in 2014 to 29% in 2023, which I think is very, very stark, because we're just saying that 30% of our local authorities now have some form of provision in place. The UK average cost of a meal has gone up from £4.03 in 2018 to £4.81 in 2023. All the research that is done with regards to Meals on Wheels consider it to provide essential preventative service for the NHS. It also helps with discharges from hospital and support that person coming out of hospital earlier and avoid the term bed blocking and delayed discharges there. Meals on Wheels won't solve all the issues with regards to the elderly and the crisis in the NHS, but it is certainly a jigsaw piece in that solution. And I think it needs to be part of the wider council strategies. So, for example, your food security, cost of living, and also helping the older person stay in their homes and independent for longer. As part of the survey, we asked local authorities if they received any NHS funding to support the service, and I haven't found any that received that direct funding from the NHS. So obviously that is an issue when the financial benefits and the wider benefits are supporting the NHS in their work. And a bit of doom and gloom really to look at is that many councils have indicated that they are reviewing their provision based on budget pressures and also the cost pressures that local authorities are facing at the moment. So it is highlighted that, you know, there could potentially be further decrease in the provision. I was sort of hoping after COVID that there might be local authorities who are considering restarting the provision, but I haven't found evidence of that at this stage. Okay, now in the report you will see there's 4 really, really good case studies from four councils across the UK. And I'm not going to go into detail with them, but you can read them in the report, so you have to read the report. But they're really good examples of the provision that they provide, the different service models that they use for that provision, but also as well the benefits that they see for the service and why they deliver that service in their particular areas. So I will leave it there.
Thank you, Vicky. I'm just checking everybody can hear me. Is that okay? First of all, a big thank you to Vicky for that tremendous work on the report. Really fundamental findings there. The takeaway from it for me is that we now have 2/3 of local authorities that are no longer providing a Meals on Wheels service. And that to me is indicative of a service in crisis, and a service that has been ignored for too long by national and local politicians. The lack of its protection in funding terms has obviously led to that situation where we have 2/3 no longer providing the service. And I think Vicky's figures in the report for NACC speak for themselves. To draw attention to a few of those figures, in the areas where we've seen a stark decline throughout the period of our data analysis on the service, we see a direct correlation with services in local authorities where they have been hit the hardest by austerity. Austerity was a very unequal misery. In the areas most in need of additional support and funding, we did see a much tougher impact of austerity budgeting because of the loss of revenue support grants to local councils. So we have ended up, and as the figures identify, in places like London, in places like the North East, in places like the North West, this steep decline where we're seeing 8 and 9% provision in place in 2023. And those are the very same areas that have been hit with very steep decline in revenue support grants. So what we see is, in those very areas where we have a lot of poverty and a lot of ill health, the councils there are least able to provide Meals on Wheels services. And at the same time, as Vicky added, we're seeing councils facing a real huge crisis in their funding. Although there's an overall figure, as cited by many, going across local government, if we hone in just in social care alone, in the coming years, we face potentially 13 billion of a gap in supporting adults and children's services. And that means there's a draw on council funds generally, council resources more generally, to stoke up those gaps, those huge budget gaps in care budgets. But that is a false economy. And it's a false economy for all of the reasons that NACC, with its splendid campaigns, and thanks to Neil and Sue and the team at NACC for their consistent campaigning on this. Meals on Wheels is essentially a prevention service. We're able to stop people falling into the isolation and loneliness. We're able to stop people going without a hot, nutritious meal for relatively low cost. The figures that Vicky cited there, £4 odd, it's not a lot of money to keep an elderly person out of falling into dangerous levels of malnutrition and indeed the isolation, loneliness, the lack of that check, which means that they would then potentially become a call on the NHS or on primary care services through GPs. So the prevention agenda, which governments of all colours over consistent decades has claimed to support, is being completely ignored when we look at the context of what has happened with the Meals on Wheels service. And I have to say, this is going to get worse in terms of the general picture that we have in both local government finance and in terms of the population demographics. In 2011, we had 9.2 million people aged over 65. By 2021, that figure had already risen to 11 million, and it's going up. We have an ageing population across the UK, and effectively now in 2023, we're not far short of over 20% of the population being aged over 65. What we do suffer from in the UK is an ageing population that's ageing badly, ageing in poor health with multiple needs, and that's growing the pressure on social care services. So being in a position to look at prevention, to look at the whole health and nutrition outcomes, to look at the social contacts, avoiding isolation, has to be part of the prevention agenda. And yet when it comes to the Meals on Wheels service, councils are making very stark decisions simply based on what they can afford to do. And in terms of their affordability, this service, the Meals on Wheels service, is seen as expensive because we're not measuring the outcomes of the service effectively when we're making those budget decisions. And unfortunately, we are facing an overall crisis in council funding, which could see councils who face a Section 114 notice simply reducing all of their services down to the absolute bare minimum that they can get away with providing. And if we look at the numbers of councils potentially falling into that, we know aside from the 12 that Vicky mentioned, there's 20 plus others that are just behind the curve on a Section 114, but have made very clear that they are potentially heading into that situation in 2024, if not 2025. So this crisis in overall council funding is having a bigger impact in terms of the crisis in social care and the crisis that we now face in school in Meals on Wheels services. So I would strongly urge a position whereby local politicians and national politicians put Meals on Wheels at the heart of prevention strategies when they're exploring how they respond to the local crises in social care and care of older people that we face. And it has to be said, this also ties into the crisis that we see in terms of the care workforce in the UK. And I'm including within that the very people who produce and deliver Meals on Wheels services and who go into homes and make those really important contacts with older people that otherwise would face isolation. By 2030, it's estimated that the care workforce across the UK will be short of around 500,000 staff. That's almost double what we now face in terms of the shortage of care workers. And what better way to integrate domiciliary care, going into somebody's home and assisting them with a Meals on Wheels service as well. They're effectively two sides of the same coin. Going in, supporting somebody, giving somebody that love, that care, that attention, but also making sure, as we all would do with our elderly parents, making sure that people are well fed and feel cared for. So facing this crisis, we need to look at it from a multiple series of actions. Address the funding generally in local councils. As called for in the press, and Neil's done a great job over the last couple of days promoting the report, but as called for in the press, we need ministerial intervention now to stop further decline in the funding of the Meals on Wheels service. We need those interventions to happen now to stop even more councils ending their Meals on Wheels service. And we hope that the report today will actually make some local councillors, some council leaders, cabinet members for social care sit up and actually reevaluate the merits of reducing the Meals on Wheels service and reevaluate that through the prism of prevention. The second thing that we need to do is look at that overall funding of social care for local authorities and make sure that when we're assessing social care need in a local authority, there is an assessment that includes the provision of Meals on Wheels in a very clear and unambiguous way to enable it to continue to be part of that lexicon of prevention, and also enabling people at the NHS end to leave hospital with a good package of support, because that's the other thing that's often missed in terms of addressing what I don't agree with the terminology bed blocking, but the prevention of people being able to leave hospital and go home in a supported environment is often for want of support when they get home. And what better way as part of those packages of support than to include an excellent Meals on Wheels service that's also a check-in service for those people being discharged from hospital. So I really welcome today's report. I welcome the work of NACC in highlighting the importance of Meals on Wheels. But we all need to continue the campaign to make sure that we are able to address collectively with ministers, with local councils, with local political leaders, the value of Meals on Wheels, and really campaign where they've been stopped, for them to be reinstated, and stem the decline now by bringing forward packages of support that will prevent further closures of the Meals on Wheels service. I'm going to stop there, Tash. I'm conscious that in the chat there are some questions that have been brought through, including one which I believe is from Angelica. And if Neil and yourself are okay with this, I'm happy to comment on that or bring Angelica in if she wishes to ask the question in person. So the question from Angelica is, it's important to highlight that even cost increase, which can be expected, the price can be considered low compared to how much a two-course meal from a supermarket would cost. Still, however, important to recognise that not every adult with care and support needs would be able to afford that, e.g. people on state pensions. So I'm sure Vicky may want to come and comment on this as well, but my own comment on that, yes, you know, the cost that local authorities are providing these Meals on Wheels on are actually very efficient. They're not extortionate in the least in terms of the price paid for that. But absolutely for some people, there would be a question of affordability. But what I would say is delivering a hot meal to older people, given the cost of living crisis that we face, is also a way of ensuring that older people aren't too afraid to put on their ovens and heat food. And this is actually a way of also addressing that energy crisis that many pensioners are living in, where it is the choice between eating and heating, but equally from a food perspective, many making the choice not to cook food because of the cost of fuel at the moment. So I think the Meals on Wheels service does two things. It provides that hot, nutritious meal, and it takes the fear away from the most vulnerable and the poorest pensioners of actually having to cook for themselves. I will stop there in case Vicky also wishes to comment on that particular point.
I definitely think the cost of providing the meal is relatively affordable for some, not for everybody. And the supermarket alternatives are very expensive when you do look at them. I think the thing about the Meals on Wheels service as a provision is they don't just get the hot meal provided, it's all the other add-on benefits that go with that. For example, there's a local authority who does a bit of a safety check around the house, make sure that they're not using unsound heaters or plug sockets that need rewiring, that sort of thing. So they do a whole benefit of service, but they also can support the older person by signposting on how to reduce their energy bills and that sort of side of it, which you just can't get from a two-course meal from a supermarket. So I think the benefits of that £4.20, whatever the average is way more than just the food on the plate, for want of a better thing. And I know Angelica's reports, and she's done some excellent work down at the university there, highlighting the benefits of the service. I think I did have another question about the £8 meal. This is public knowledge. It's on the council's website. It's actually Plymouth City Council who charge £8, and part of the reasoning for that is so they can provide the best value food, best quality food in terms of nutrition, but also the additional services that go around that. But also I think it highlights that the local authority doesn't have much alternative under the budget pressures, but to increase the prices. But having said that, throughout the research, we are seeing that local authorities and providers are doing the absolute best they can, working with suppliers, changing the menus, and trying to work around the service without putting the inflationary costs on the end user. So let's have a look. Just have a look, see if there's any more questions there. Okay, there's a question in the chat box. I'm just reading. It takes me a bit longer than most of us to read.
Vicky,
Yeah.
I was just coming back onto a couple of those, and one actually touches on the issue of procured contracts, and variations in pricing, for example, additional pricing over bank holidays. And again, this is part of when it becomes kind of a contracted service. To be fair to contractors and councils alike, if it is an issue of trying to recover the full costs for the service, then clearly the contract will be structured in such a way that it will wash its face financially. I think what the NACC report has called for is that injection of funding into this in many other areas, many other walks of public life. We ought not to expect, because a public service should effectively be funded through taxation, we wouldn't necessarily expect the recipient to have to top this up. Now, there are some examples of that. If you think of, dental services, for example, where there's a set price. But what we have here is vagaries across different local authorities in terms of charging structures and whether or not the service is subsidised or not. If there was a recognition that this should be provided as a service, you can then get into the debate about what universal standards of a service would look like and what a fair pricing structure would look like. But unfortunately, because of the myriad of provider models, with some councils needing to recover full monies, some councils willing to subsidise the service to enable it to become more affordable for more people, we do have this differentiation, and there is somewhat of a postcode lottery there. There's a postcode lottery whether your council provides it, and there's postcode lottery in terms of how much you would pay. So thank you for that question, which I believe was from John.
I was just going to come back in on one of the points that John's made about signposting not being the same as a supported framework, and I totally agree. And that's why it wasn't included as a form of provision. So none of the signposting authorities are within that 29% in the research. And also you do make a point about providers deciding where they want to provide the provision. And I think there's two things with that, and more touched on it with the deprivation. In areas where you've got high deprivation, you've got people who are working potentially more hours on a lower wage job, so they have less time to volunteer for things like Meals on Wheels services, therefore the voluntary provision isn't necessarily there. And the private sector companies won't always provide in them areas. We do see the same with school meals in that respect. So sometimes the local authority is the only backstop for providing that provision in them areas, but they're the councils which are heaviest hit on the budgets in terms of deprivation and needs of their authorities. So yes, totally agree with what you're saying there, John, with that point, and very well made point there.
And Vicky, there's another question there from Craig, which is a point rather from Craig, which is, in terms of the people being able to go to supermarkets and pick up food, that cost price issue that Angelica raised, of course, very fair point there from Craig, that some individuals simply would not be able to get to supermarkets to collect and cook that food. And there's also a lot of assumptions that are made when people are talking about the Meals on Wheels service. We've come across this in the past. People say, oh, well, it's kind of old hat now because, there's online shopping. People are much more independent. The reality is some of the people most in need of Meals on Wheels services are also the most digitally isolated and simply cannot access services in the way that other consumers can. So a really good point there, Craig, as well.
Okay, I'm just picking up Tilly's point there. We do go into details about the sample size for the data in the report, so I won't go into the facts and figures for that now, but it is in the report, and it is across all local authorities that provide the provision versus all those that did provide but no longer do. So the statistics are in there. And yes, it is. Scotland is very different, and I think in terms of the devolved policies, and I think that one thing is coming out with the data is they're provisionally stabilised. A lot of that is to do with their policy position from their national government downwards, in terms of the more integration with the health and social care, which you've put in your comment there, and also stronger linkages with supporting older and vulnerable in communities. And there's a lot more stronger emphasis on that, on the national politics in Scotland. And I think with the divergence in policies, we are sort of seeing that play out in the provision across each of the devolved nations in that respect.
There's a question there that may be more suitable for Neil at the end there, which is about the choice of menus, Neil, between summer and winter, and getting the same choice across the summer months as the winter months, which my children would complain is probably tantamount to my limited good recipes. But I don't know whether Neil wants to comment on that.
I think what I'm going to do is I'm going to come back to that question just because we're about to run out of time, and I just wanted to do a bit of a closing. So Tilly, I think the question was from Tilly. I will come back to you on that, Tilly. In fact, I'll come back to everyone on that after this video. Sorry, just having a few technical issues there with my video. We're just about to come to the end of the webinar, and what I'd like to do is just say a really big thank you to Mo and Vicky, who have been, and APSE, who have been working with the association on this report over the last 6 months or so. Vicky's been really instrumental in putting the research together and doing the report as well. So thank you to Vicky and Mo, who supported the association on this report. If you haven't seen the report, please do check out the NACC website, where the report is now on the Meals on Wheels page. But there is also an opportunity there to download the 2 reports from 2018 and 2016. And it's just an interesting read to go back and have a look at the reports from 2016 and 18, and where we are this year as well with the report, if you have that time to do so. Just as a reminder, the webinar has been recorded, and the webinar will be available as well on the NACC website, and the team at McCullum Moore will be sending it out to you all who are as part of this call. I also wanted to do a bit of a reminder that we have got another webinar coming up this week for Meals on Wheels Week. The next webinar will be on Wednesday, the 1st of November at 3 p.m. and it's for an hour. And the topic of this is around raising awareness of the service. The webinar will be looking at the benefits of Meals on Wheels, particularly around the ones beyond nutrition, and we'll highlight why there is a need to raise the awareness of the Meals on Wheels service. And this will be coming from the perspectives of researchers from the USA, a service provider in the southwest of England, which is Bristol City Council, and also from researchers from the School of Policy Studies at the University of Bristol. So thank you again, Mo, Vicky, for your time today. And thank you to everyone who's joined us on this webinar today. And we look forward to seeing you on Wednesday. Thank you.